patients who want to return to work, keeping that desired activity level is quite important. So those considerations, how do you sort of help them and steer them with those that want to get back to work quickly?
Yeah, exactly. I mean, we are always mindful of people rushing back to work in that
Mm,
early post-operative period.
yeah.
They've got lots of appointments. There's the highest risk for infection, for example.
Mm,
So to some degree, it's not rushing back to work. It also depends on what work that is for the person.
yeah.
Every job is different, in terms of both the infection risk, for example, but also the physical demands of the transplant, the flexibility of the workplace. So people are going to turn up for their appointments and have their bloods, for example. So again, it's an individual conversation we have with
Mm,
patients, trying to help them ease back into the workplaces about what timing might be right. And as to, even is going back to that work, in their best interest necessarily, or, change of field might be, better called for example. So,
yeah.
and some people, of course, don't want to get back to work depending on their age. They've had their transplant and they're quite happy not going back to work. And so,
Yeah.
exactly right, it's maintaining that. But again, getting them back to their social goals as well is really important. So, what can we do to help maintain their physical fitness, for example, to help them, live out their lifestyle that they would actually choose to live?